Welcome to the Biohacking Superhuman Performance Podcast. My name is Natalie Nidham. I'm a nutritionist, a human potential and epigenetic coach, and I created this podcast to bring you the latest ways to take control of your health and longevity. We cover it all, from new technology to ancestral health practices, personalized interventions, and a very special interest of mine, peptides. Enjoy the show. In this episode, I welcome back Dr. Amber, naturopathic doctor in LA, California. Dr. Amber specializes in women's health, hormone testing and treatment, regenerative medicine, and peptides. And Dr. Amber and I kind of pick up on our last conversation. We go on and talk about a third mitochondrial peptide called MotsC. You've probably heard of MotsC. It's a really cool peptide that naturally exists in your mitochondria. And unfortunately, that the levels of which start to diminish as we age, or certainly in certain disease states. So it's a really important compound. It's all about making energy. And we talk about the many different applications for MotsC and everything from energy optimization to weight loss, bone health, heart health. It's like so many other peptides, it's a tiny but mighty little molecule, and it does many, many different amazing things for the human body. In the second half of the podcast, we then move on to NAD, which is related to MotsC, where there's actually a part where we talk about how literally they cross over and help each other. MotsC leads to NAD, and NAD is this energy currency. We need NAD for every function, which probably is why there are so many new products coming out, from precursors of NAD, NMN, and NR to actual NAD itself. So we talk about the different ways to administer NAD, the pluses and minuses of them, and why you might want to choose one over the other. And finally, that's pretty much it. So that's the podcast. It's actually not super long, so hopefully you'll get lots and lots of value out of it. And if you do get value out of this podcast, then please leave us a written review on iTunes or Google or Spotify, wherever it is that you're listening to the podcast, because it's those reviews that allow the podcast to be seen and allow us to climb up the ranks and allow me to get more amazing guests for you. So if you're ever looking to comment on the podcast, to reach out to me, if you have any questions, anything like that, you can reach out to me through my website, natnidham.com, or you can find me on Facebook at the Biohacking Superhuman Performance Group. Thank you so much for joining us today, and let's have a chat with Dr. Amber. Okay, welcome back to the Biohacking Superhuman Performance Show. I'm Natalie Nidham, and today I am so happy to welcome back Dr. Amber to the show. Hello. Hi. Welcome.
Thank you for having me.
Oh, well, thank you so much for coming back. I mean, it's so funny. After our last podcast together, we were like, okay, we got to do this again. And then within 2 days, I'm messaging you going, hey, what about this? Can we talk about this? And you're like, yeah, let's do it.
Yeah.
So, and it's interesting because it's an offshoot. It's almost like a continuation of our last discussion where we talked about SS31 and 5-amino-1-MQ, which are two mitochondrial peptides. We left one out, maybe for time purposes. And so today we're going to talk about the third. I guess it's I'm sure there's others, or maybe they're coming, but it's the third mitochondrial peptide that people talk about the most, which is MotsC. And then we're going to get into another really interesting topic, which is not a peptide, but possibly is the reason why people try and use these mitochondrial peptides. It's really to increase intracellular energy, so NAD. Right. So when it comes to MotsC, there's so much information out there. Like when I first learned about MotsC, I learned about it from the point of view of how there are high performance athletes that used it to enhance their performance, obviously. But over time, I've seen people online talking about it for weight loss. And I'm just going to put out a lot of stuff and then we'll kind of dig into it. And then also other things that we hear about it, which is really interesting. Like I hear about people who their energy is really on the floor and it seems to give them this really nice lift. And then other people who are trying to use it for optimization purposes and they don't sleep for days. They just don't. It trashes their sleep. So I have a feeling there's something going on. Like, I wonder if it's using the wrong thing at the wrong time in the wrong way and ending up with like too much of a good thing.
Right.
But why don't I let you talk, and why don't you talk to us a little bit about MotsC, what it's all about, and what some of the best ways are to use it?
Yeah. So And I've seen all of those experiences with patients too. When we're talking about mitochondria and ways to upregulate mitochondria, we know that MotsC is that peptide that we find in the Japanese who live a long time. So it's linked to longevity. And it plays a huge role in our uptake of glucose. So we think about insulin sensitivity and how that's really related to faster aging. We have a lot of that excess glucose. So eating a high carbohydrate refined diet, we have a lot of those simple sugars. Part of what happens with the peptide MotsC is that it will shuttle the glucose into the cell through the GLUT4, so that glucose transporter. And it's really important essentially for energy production that way. And if we're depleted, if we're not making as much of that peptide, that MotsC, of course, we're not getting as much glucose into the cell, and that glucose can be damaging tissues over time, right?
Oh, so that's where it oxidizes, like the whole, is it AGE? Like it oxidizes?
Yes. Yes.
Yeah.
There can be glycation. They talk about glycation end products.
Glycation, that's what it is.
They call them the AGEs, AGE, advanced glycation end products. So we can actually damage a lot of tissues in the body when we have that excess glucose floating around. We know that MotsC works on a similar pathway as exercise in regards to AMPK, the signaling pathway there. So, of course, I encourage my patients to regularly exercise, but what we're seeing when we add in MotsC is it kind of mimics what is happening in the body and the mitochondria when we do exercise. A similar metabolic pathway is happening. So that can be really important. And what's really happening is the upregulation of GLUT4 receptors in the skeletal muscle. So you think about...
Yeah, so it's very specific to muscle, right? Yeah.
Yes, that skeletal muscle, right? Which is what when we're exercising a lot, that's really where we have the increased demand for just plugging away at glucose and shuttling it in for energy. The other things that it can be, we think about diabetes and what a rampant thing that is in America right now, blood sugar dysregulation. I would say the majority of the patients that I see will have some sort of blood sugar dysregulation. And that could be fatigue after meals, so not able to shuttle glucose appropriately into the cells for utilization. That could be not able to go long between meals, so that hypoglycemic picture, that's the hangry person, right?
Mm-hmm. Yeah.
And
we've all met them.
And we probably all felt it too at some point, right? We know when you don't sleep enough, your blood sugar regulation is also compromised. It's so interesting because I have some patients, and MotsC, when we boost that, for some people will cause sleeplessness. Mm-hmm. But we know when you're sleeping that you have mitophagy. So the old mitochondria are being recycled. So sleep is a really critical process for our mitochondria. Where MotsC plays a role is it can actually increase intracellular NAD levels. We know that when we don't sleep, say we only get 4 to 5 hours of sleep a night, which is, a lot of people on Wall Street, a lot of people in America working really stressful jobs, that's the reality for them.
Yeah.
Not getting that cellular repair at night, and that is compromising, mitochondrial function, but MotsC in general. The sedentary lifestyle, not getting the exercise to stimulate that pathway. So, this is a solution for somebody who's not recovering during their sleep. They probably have some mitochondrial dysfunction. We could talk about all the symptoms of that. But it can help with weight loss in the sense that it can stimulate what exercise does for us.
Right.
Yeah, in burning fat. And it actually links to heart health. There's a lot of mitochondria in the heart tissue. That's a muscle, really powerful muscle. And then bone health as well. So osteoporosis, it's been researched for that.
Really?
Yeah.
Huh. So, and would that be a direct effect, you think? Or do you think it's because it affects skeletal muscle and skeletal muscle affects bones because as you're controlling, like if you're able to exercise better, do more weight-bearing exercise, you're going to stimulate those bones to regenerate more.
Exactly. Yeah. And if it helps to shuttle nutrition into the muscle tissue, the muscle can only go as strong as the bone is.
Right.
They're really one unit in a lot of ways. So yeah, I think it's the relationship between both of those and really energy utilization in the body.
Okay. So then on the sleeplessness for people who use MotsC, do you have any idea why that is? And is there a way that they can use it so that it doesn't damage their sleep? Like, do you think they're trying to go too high dose, or are they using it at the wrong time of day? Or
it could be a combination. Sometimes the issue when somebody takes MotsC may not be that they're low in MotsC. Right. A lot of people might be, but if they exercise a lot and they're already kind of a really into a health proactive preventative lifestyle, they may be doing other things that are boosting their mitochondrial function. Like even the CJC and ipamorelin will boost mitochondrial function, NAD to NADH ratio. So it may not be, if you add in MotsC and we already have, repleted levels, it can really push that pathway. Other than that, we don't really know. It's essentially just an overstimulation in that pathway. Right. They probably have enough of those signaling molecules.
And do you think there'd be, other than the lack of sleep, which is a pretty big downside anyway? I mean, as you said earlier, without sleep, there's not a whole lot, you miss out on a lot of the very vital anti-aging and optimizing and health benefits that you get in sleep. But do we think that there might be any other downsides? If somebody's using MotsC and they're seeing this effect of sleeplessness, which, may mean that they're just overshooting the mark, as it were, is there an other downside to that? Or is it really just probably not just because isn't there a thing about MotsC that it somehow it taps into the c-Met pathway, which is a pathway that might get activated in certain types of cancers? It's one of the things that I first learned about MotsC. And so there was a little bit of a caution there that said, in people with a history of cancer or active cancer, you probably would stay away from this peptide. Yeah. And it wasn't necessarily from a direct relationship. It was more of a, we don't know. And then, in talking to other practitioners, I think that there's a sense that as long as you don't override pathways, you're generally safe.
Yes.
But in this instance of people using it who don't really need it, is there a possibility that in those people, they're over-activating pathways that could possibly get them into some kind of trouble?
Yeah. And I'm glad you brought that up. It is possible, theoretically. There's no direct link correlation that we've seen that research has proven that MotsC, will cause that. But theoretically, yes, if somebody is stimulating that, we just talked about how MotsC helps shuttle glucose with the glucose receptors, and, cancer feeds on glucose and sugar. Mm-hmm. So on one level, it helps to lower those blood glucose levels so we don't damage some of the tissues, leading to blood vessel damage, which can lead to cardiovascular issues later on. So then in that sense, it's very protective. But yeah, if we do have some cancerous cells, and there's lots of other things that are happening in a cell, depending on the location of the tissue that would trigger cancer growth. So we think about liver detox and estrogen levels and not being able to process that, and for women especially. But there's so many other things. Mitochondria is just one puzzle piece, and that's where it becomes tricky with some of these peptides and therapies, because we're supporting people on one level, but we're kind of taking one pathway. We're talking about one pathway in the mitochondria. There's 100 other pathways happening simultaneously.
Exactly. Yeah.
So yeah, it is possible.
Okay. And then one of the other, I'm just going through all the things I've seen about it. There's one doctor in particular who's big into women's health. And she speaks to MotsC as this miracle compound for women going through menopause who have stubborn fat that they just can't get rid of, or I don't remember if it was postmenopausal weight gain or going through menopause. Have you used it in that way before? Have you seen that be particularly effective?
I haven't used it in a ton of my postmenopausal patients. I could see why. I mean, your insulin resistance typically goes up in menopause. because of the drop off of a lot of those hormones.
Yeah.
And we are doing bioidentical hormone replacement therapy and adding those back in, a woman is more prone to fat storage because of greater risk of insulin sensitivity issues. So definitely it could be used for that when you think about the uptake of glucose and the process there. But, the severity, I also think about, the mitochondria, since that's relevant to this conversation, is where our cortisol is made. It's where our progesterone is made. It's where our estrogen is made inside the cell. And so it's a hormone producer, right? So if that mitochondria is depleted in producing ATP and energy and MotsC, it's probably not an amazing hormone producer as well.
Yeah, that's interesting. Yeah.
And we know that women going into menopause that are very stressed, so they're super cortisol producers, that they will have generally more severe symptoms going into menopause. And that, when I think about cortisol production, I think about, that's an energetic tax on the mitochondria. So think about the chronic coffee users, constantly drinking coffee, robbing Peter to pay Paul for cortisol, and that's a mitochondrial production.
It all comes down to those little mitochondria, doesn't it?
I'll come back to that.
It's all about the mitochondria. Yeah. It's all about you. So for your patients who use MotsC, you wouldn't, even though it's an exercise mimetic, I'm sure that you're still encouraging them to exercise, because wouldn't that just amplify the benefits of the MotsC?
Yes. Absolutely. Yeah. Especially if weight loss is the goal, the chief goal. And a lot of times it is.
Yeah.
We also know that there's other benefits for exercise in blood vessel health and, blood flow to the brain and, bone health. We need that resistance on our bones and muscles. So there's lots of things that you cannot get from MotsC. You need the exercise to get those benefits. Yeah.
Well, it's interesting because we talk about fasting mimetics, we talk about exercise mimetics, and I think it's human nature that we're always looking for that quick fix. We're always looking for the magic bullet, as it were. But ultimately, even though a compound may be an exercise mimetic or a fasting mimetic, it never really fully replaces the actual action. So I think helping people to understand that it's going to give you an edge as opposed to make up for.
Yes.
Or fully replace.
Absolutely. Yeah. We can only do so much, but we can't cheat nature.
No, you can't cheat Mother Nature. She gets super cranky when you try to. There's always a price to be paid.
Yes. And I've seen that.
Go ahead.
I've seen that with other peptides too, where, patients can maybe they'll cheat a little bit on their diet, or they won't get as much sleep one night. And the peptides do not save them. They optimize and they help optimize those pathways. And you definitely notice a change when you're on them, but they will not make up for those lifestyle pieces at all.
Certainly not day after day after day, for sure.
Right. Yes.
So then in terms of how to use MotsC, is it like a 4-week cycle, an 8-week? Because it's not an always thing, unless maybe if you had someone with real, like a mitochondrial disease or something, maybe in that would be a separate case. But for the average person who's thinking they might want to use MotsC, and it's not a cheap peptide, like it's I call it an investment peptide. There's, you got your run of the mill guys that, like the ipamorelins and the CJCs, the BPCs, like they're not super cheap, but they're manageable. But this is one of those peptides that you kind of got to get yourself ready. You got to gird yourself for a bit of a chunk of money. You got to save up for it. So what's a typical cycle that you would use with someone? And then once they stop using it, do you think, I guess to that end, like if they've taken the opportunity to tap into that extra energy, they might get back into exercise, get into moving. Do they see the benefits last after the MotsC, or does it go away?
Yeah. With some of the peptides, like the CJC ipamorelin, it can improve baseline levels. So even when you discontinue it, it can help that function. With MotsC, a lot of times people notice better energy for sure when they're taking it. you don't feel exactly the same once you discontinue it, but those baseline levels might be higher than where you started from.
Nice.
For example, not exactly the level that you'd be at taking it. And I like to do, so there's different dosing protocols. I like to do a higher dose for 4 weeks, and then I'll drop down. So they're doing it 2 times a day, sometimes 3 times a day. And then I'll do a dose of once a week or once a day for 2 weeks. So I'll kind of drop it down after that 4-week period is done. But there's different dosing protocols. I have Dr. C.
I have that book too.
Yeah. So there's all sorts of different ways to dose. That just depends on the goal.
Yeah. No, in that book he talks about, which is a protocol I'm more familiar with. It's the 5 milligrams. I think it's 3 on like Monday, Wednesday, Friday.
Yes.
A day for 4 weeks, and then dropping it down to once a week. And so when you do your multiple day, is it lower dose, but multiple times, like you kind of split up, whether it's 5 milligrams or 6, whatever it is, do you split that up over the day?
Yeah. So it would be 5 milligrams in the morning, 5 milligrams at night, or not at night. Sorry. Two times a day. If they do it 2 times a day, it'd be 10 milligrams total.
A day. Every day?
Just for the initial. Yeah. So it'd be that fine. Well, and you can
you really got to save up your penny. You may have to sell one of your children or something.
You can also tailor the protocol based on cost. So you can dose that down a little bit just because of the price piece. Yeah.
That's interesting. So why would you multiple dose it over the day? Do you find that it's just a more consistent ride for the patient kind of thing?
Yeah. And it depends on, because you don't want to dose it too late in the day because it can be way overstimulating for the person. Generally, that's going to be done in the morning. Yeah. So, no, I think I misspoke. So it's 2 times a week, not 2 times a day.
Okay.
For the vial.
2 times a day. Wow.
One vial, you have to reconstitute every vial. So you want to use that up in one go because it's a very not stable peptide. We need to utilize it. So it was 2 times a week, not 2 times a day.
Okay. Yeah.
For 4 weeks. And then I'll drop that down to once a week.
Interesting. But, again, like you said earlier, it's really going to depend on the person. Like I'm sure even within that protocol, you've got variations depending on the individual, what they're dealing with, what their baseline is.
Yeah, exactly. Yeah.
There's a whole lot of art to this science. That's for sure.
That's very true.
A whole lot of art to the science of peptides. Okay. Is there anything else we want people to know about MotsC, or do you think we've more or less covered it?
You may see other forms, like there's some other companies who come out with troches and some patches for some of these peptides. I haven't really seen that much for MotsC, but you'll see that for some other peptides. And the injection is just the best way to go. Yeah. With MotsC for sure. And with most peptides, you're going to see a better result with the injection than most of the forms. There's a couple exceptions to that, BPC capsules and some of the capsules for specific peptides. But this is an injection. Yeah, I'm definitely seeing, even yesterday in the group, the Biohacking Superhuman Performance group, somebody came out with these Epidolon sublingual tablets. And I'm like, I don't know, and they're not cheap, right? So you're I'm like, I'm not so sure. I mean, at least sublingual, it's getting into the bloodstream, so you're not pushing it through your digestive system. Right. But I mean, even with BPC, which is orally bioavailable, we know that you end up having to use a lot more to get the same effect than if you were injecting it. So I would guess with MotsC, that would at least be the same if you could even get it as a troche, a sublingual troche. And I don't think you can in that one. AOD used to be able to get in a troche, and I experimented that one on myself because that one's also used for fat loss and signaling of growth hormone receptor. So, but in my own personal experience, just the injections just tend to work better for results. Yeah. Absolutely. Cool. All right. So let's get into our little mitochondria now, and let's talk about NAD. So NAD is the magic substance. Everybody wants it. You want it in
you want it in balance with NADH, like you want all this stuff about NAD. But what's come out over the last number of years are all these supplements. And a lot of it comes out of the work, I think, from Dr. David Sinclair's lab with NMN, NR, NAD, NMN and NR being precursors of NAD. All of these, of course, going back to good old vitamin B3, like niacinamide, right? So I've had people in the group go, save your money. Don't bother with any of that stuff. Just take a bunch of niacinamide. But then I've also heard that too much niacinamide is not necessarily a good thing. So maybe we should start upstream and start with the precursors and then move our way over to NAD, which is, all the rage these days.
Yeah. So there's NMN, which is our nicotinamide mononucleotide. So they all just have abbreviations.
Yeah.
Why we just say the abbreviation and not the full name. And then NR is nicotinamide riboside.
Right.
So precursors to NAD. I do have patients who come to me taking some of the precursors. The issue sometimes with more capsules, other than things like BPC, which I use a lot, is the gut absorption piece.
Mm-hmm.
For example, I have patients who, I had a patient who had really low total protein on a blood test. And this is a bodybuilder guy who eats a ton of protein. And why is it low on his blood test? Oh, well, he's not absorbing it.
Yeah.
So low HCl production, inhibiting pepsin, can't absorb, break down, digest the proteins. So you think about proteins in our food are also a source of amino acids and peptides, which are signaling molecules. That's why food is medicine.
Yeah.
But he's the absorption piece. What I'm getting at is the absorption piece. So for a lot of people, they're just not simply going to absorb 100% of any supplement.
Right.
And there still can be benefit of using these, but whenever you give a precursor, your body has to do a little bit more work to get to the active form. And so we're trusting that all of the coenzymes, all of the things that we need to get to that active NAD are there in the body. And we simply don't know that when you take something like NR or NMN. So a bioavailable way to go about it is just to give straight NAD, because we know that your body doesn't have to do the whole conversion process there. And then, we just know that NAD is really the molecule that we want to get to. But there are some people who prefer the capsule form, and there's all forms of NAD we can talk about. Mm-hmm. But ultimately, the goal with all three of these is to increase NAD intracellular levels, which has energy production. We know that NAD actually, I think one of the most important things that it does is it actually protects our DNA from damage.
Yeah.
Which is a huge piece right now when we're constantly subjected to our environment, which we don't know, a lot of the things can damage the cell. So that's a really big one. And then energy production, our brain, our nervous tissue, and our muscle tissue has high amounts of mitochondria, up to 10,000 mitochondria in every cell.
That's amazing.
Versus other cells in the body have about, 1,000 to 2,000. So significantly more in those tissues. So we need NAD to really protect those tissues and to keep them firing and wiring to protect our DNA. And I love what Dr. Seeds talks about and what we learn in a lot of our peptide training. It's peptides and NAD are about helping the cell to function better. So improving cellular efficiency. And NAD is just one of the more effective ways to address more of a root cause of a lot of these. There's a lot of research about mitochondrial dysfunction and these chronic illnesses, especially neurological issues, MS, ALS. There may be a link between the mitochondria and some of the decline in these tissues. So that's where NAD can be a really powerful molecule.
So it's almost going at the root cause of so many of these, and I mean, virtually any disease, including if we consider aging a disease.
Yes.
Is going to be in some way supported or helped in the way. Yeah. So then let's talk about the different ways of administering NAD, because there's an increasing number of ways to go about it. Yep. We can start with the most aggressive and maybe possibly the most effective would be an NAD IV, right? But people talk about NAD IVs being this horrible experience that, you feel awful. It takes hours upon hours. It's pretty expensive. But then, from the IV, we can go into these now NAD patches, which goes across the skin, or we're starting to see NADs. Well, not starting. I mean, they've been out for a while. You have sublingual NAD, which is going to get into the bloodstream. So
Yes.
let's unpack that a little bit. Let's talk about the IVs.
Yeah.
Are they as horrible as people? And there's something you can do to make it better. So maybe you can talk about that.
There are some things you can do to make it better, but usually it's that stomach flipping feeling that you get with an IV, and it has to be dripped really slow to kind of to not experience that to the point where it's so bothersome. So we drip it slow, generally over 4 hours if you're getting a high dose of NAD. And typically, sometimes what I'll do is start people at a lower dose just to see how they respond, maybe 200 milligrams, and drip that pretty slowly. And then you can always work up to that 500. The great thing about the patches is that you can get a really generous dose for a fraction of the price from an IV. So an IV can be $500+. A patch can be, around $50. And that's substantially, a tenth of the price for a better dose. And, if we just slap some NAD right on the skin, nothing would happen. It just doesn't absorb that way.
Right. And is that because the molecule's too big, or is that just because it just doesn't cross?
Yeah, it's too big. It's just not bioavailable transdermally if we just put it on the skin. And so there was a really smart group of individuals who said, hey, let's come up with an idea, a way that we can get this to be bioavailable. And that's iontophoresis. So it's a little mechanism that you can put that NAD solution, which is a refrigerated substance, onto a patch. You can wear that during the day. And, everybody responds differently. Some patients do have that, similar to MotsC, where they like sleeplessness if they use it too late in the day, because it does really can energize you. I've had some chronic fatigue, insomnia patients who've really benefited from this, because you think about it, they're not getting that deep, restful sleep. And that's when a lot of their mitochondria is repairing, NAD being recycled. So we can use certain peptides. CJC hypermorelin will help improve NAD ratio to NADH. But so the patch is an option over the IV. It can be done from home. It's really a simple way to go about doing it. There is a liposomal form of NAD that's made by Quicksilver company. So there's that form which can be taken. Is that taken like sublingually or? Yeah. Yep. Liposomal. So going to be great bioavailability. Think about liposomal vitamin C, liposomal glutathione. We can now do NAD that way. And there's NAD intranasal.
Oh, right. I've used that. I have some here.
How did you feel on it?
The first time I used it, I think I got a headache. And maybe I used too much. I don't know. But after that, I mean, it's funny. I often don't feel that much. I have a fair amount of energy.
Yeah.
So maybe my baseline is at a certain place where I don't necessarily experience that noticeable lift that maybe someone who really is much lower down. And maybe if I used it, maybe I have to wait for a day when I'm like really dragging myself. It happens on occasion, and see if that kind of clears the fog, as it were.
Was that with the RG3 and the B12 as well, or just NAD?
It was the Alive by Nature one.
Okay. There's I think it's a patented product now, but it's called Synapsin. And it's actually the combination of the NAD, the RG3, and the B12. Now, RG3 is that red Korean ginseng that really is supportive for the brain and memory. BDNF. Boost BDNF. So that one can be really great. I actually like using that I like using the intranasals in patients with mycotoxin or Lyme, because I think it can really benefit their brain and protect their brain from some of those chronic infections. And talking about chronic infections, a lot of times those patients will have tremendous amounts of fatigue,
right,
mycotoxin exposure. And part of the reason why is it's almost like that those NAD levels may be depleted. The mitochondria are not able to produce ATP and energy quite as effectively. They're just fighting a chronic infection load. And so many of those patients do benefit from some mitochondrial support, whether that be the intranasal NAD, the NAD patches, or some other form of mitochondrial support.
Nice. So for the NAD patches, so again, I'm guessing that those 6, because they come in a box of 6 typically, you get 6 patches. And so I would guess that the rate of administration will vary by individual based on where they're at. And like there's no real rules, right? You could use one every day if you wanted, or once a week. Like I've read all kinds of things, like people use them every other day for a period of time.
Mm-hmm. Yeah, it really depends. So if it's more of a preventative situation, somebody's looking to do general preventative wellness, maybe they have some mild fatigue, but no real pathology or diagnosis that they're working on, then once a week is really the recommended dose. If it's more of a chronic illness patient and we're really directly targeting the mitochondria therapeutically because they are very fatigued, they have insomnia, they have chronic pain, fibromyalgia, or some of these chronic infections, that's when we're probably going to want to up that dose because we know that they're already starting from pretty subpar level.
Should I talk about my experience about how things can sometimes go sideways?
Let's talk about it. I think it's worth talking about.
Okay, so I got my hands on some patches, courtesy of a certain service, and my first 2 patches were great. I think, I didn't notice so much when I was using them. And again, like you always go online and people are like, oh, mine itched really bad while I had it on. So you're kind of waiting. You're waiting for something to, at least I am, because I'm a super healthy person, but when my body reacts to stuff, it goes like boom. Right? I've had some pretty interesting reactions over the years. But, I think I slept really well that night. I used them 2 days apart, my first 2. And I felt really good. But then I thought, oh, well, maybe I'm overdoing it because I don't really need them. So I waited a full week. Now, what I did the third time is I changed the site of the patch because I was talking to someone and they said, well, the skin on the outside of your arm is not that, it's not that thin. It's not that absorbent. You might want to use it in a place that like thinner skin. And what they meant was here because like on the inside of the bicep, because there's more capillaries. If you want to hit the blood vessels, right, for it to absorb. But I thought, okay, well, I'm just going to hit like the inside of my forearm because that's thin skin. And if I had veins to show, then you would see my veins, but I don't. Every time I have to go give blood, they're like, I can't find the veins. Anyway, I put the patch on. And to this day, I'm not sure that I didn't leave it on an extra hour, but I ended up 2 days later with this crazy big reaction. I don't know if I can show it on camera here. I don't know if you, there it is.
I can see it. Yeah.
See that? Big red circle. Yeah.
Mm-hmm.
So
that was where the NAD was.
That's where the NAD was. So, and it didn't come up for 2 days, right? Like it was like this delayed. I mean, it may have been there the day after, but I didn't notice it. But it's not until 2 days later that I went to scratch an itch that I wasn't aware of. And it was like, when I just scratched lightly and it was like this crazy burn. And I looked down and I'm like, oh, look at that.
Yeah. And I've seen that happen before, but there's really no rhyme or reason that we know of yet. I've talked to some of the compounding pharmacies who, use it and produce it. And nobody really has an answer as to why you could use 5 or 6 patches and have nothing happen. And then the next one that you use, boom. Or maybe sometimes it happens on the first time and then everything thereafter, fine. But everybody responds differently.
Yeah. So I think if anybody tries a patch and this happens, just so you guys know, I was able to use a blend of essential oils that like the itch was insane. Like it was unbelievable. And it was peppermint oil with some frankincense seemed to really kind of calm it right down. But this is almost a week later. and it's definitely still there. So I'm going to screw up my courage in the next couple of days and put another patch on somewhere else.
Yeah.
I'm going back to the outside of my arm personally. And see what happens there. But I think that it's the joys of self-experimentation, right? You're always trying something different, and sometimes stuff like this can be a bit unpredictable.
The other thought that I just had too about the patch is it is very specific to the direction that you put it on the skin.
It is?
So, yes. So the arrow should be facing towards the center of your body. So if you put it on your leg, the arrow should point towards your belly button. And if
which
you
arrow?
Put it, so there's a little,
like, because it's an arrow.
It's an arrow.
So the arrow was pointing out.
Okay. So that might be why. So the arrow should be pointing towards the center, or think about like the core of your body. So whether it be on your leg, the arrow should be pointing up towards your belly button.
Really?
I didn't think about that. But yeah, so the direction is actually important in terms of the assimilation. So maybe that was.
Well, because it would have been going across.
Okay.
Right? It would have been going, like I had it going this way. It would have been going, if you think of it as a meridian, it would have been going across the meridian instead of with or even against it, frankly.
Got it. Okay.
So it's really interesting.
Go with the meridian and then put the arrow towards your heart or your belly button, towards the core.
Okay. Yeah. That's really interesting. So both other times, I think I had the arrow pointing down. So okay. Well, stay tuned, folks.
Yeah.
By the time I'm doing the show notes and posting this, I'll have tried it again. So I'll report back in the show notes.
And this is this is why you and I do what we do, because it's self-experimentation of understanding more about these therapies and how they work. And, sometimes we learn through using a peptide that keeps us awake all night. And that's the learning experience.
Oh, yeah. Or a peptide that makes us itch really badly for a period of time, which is me. And, I'm just happy it wasn't like an allergic reaction in my mind for me, because I'm a little bit prone to those. Okay. So we've talked about the patches, the IV, the sublingual, and the intranasal. I almost forgot about intranasal. And so for the Synapsin, is that a prescription product, or is that something that people can buy as a supplement?
It is. So you can, the blend of those three is patented as a specific thing that you can get through a compounding pharmacy. Okay. You can get NAD or NR, NMN, without seeing a doctor. The other one that we didn't mention is, and actually I'm preferring this more now, is the subcutaneous injections of NAD.
Oh, no kidding.
So that's using the same solution that you would use in an IV. But I've used that in some of my athletes and trainers, and they love it for energy. So it's just usually the solution that I have is 200 milligrams per milliliter. Mm-hmm. So I use about 0.2, 0.3, which is, not as much as you're going to get in an IV, but done subcutaneous injection into the abdominal fat, just like a peptide with an insulin syringe. And you can do that every day, every other day, and still get that boost of energy. If you dose it too high, like if you gave yourself a mil and you actually got 200 milligrams of NAD in one insulin syringe, the full insulin syringe into the fat tissue, you would probably feel some of that stomach flipping feeling. And once you inject it, you don't feel amazing. But if you do it in a small dose, you don't have those effects, and you do have a boost in energy, especially when you do it daily or every other day.
Interesting. And so it's the same solution that you get for the patches, but you'd want it in a different type of vial so that it would be just to keep it sterile, right?
So the NAD patch solution is only good for the patches, but the stuff that you get for IVs, it actually comes in a vial, sterile, from a compounding pharmacy. That's the stuff that you actually inject. You wouldn't want to inject the stuff with the patches.
No, because it would be a different solution. It wouldn't. Okay, interesting. And I guess with subcutaneous, it's like anything else. Subcutaneous is just so much more efficient that you don't need as much.
You don't need as much. And I've heard reports from some of my patients, like energy is amazing. amazing. Workouts are better. Brain function is improved. All of the above, muscle power during workouts. So that's also another option. And I'm actually leaning towards that even more because I've been using that more for myself, just having that vial, and that vial lasts you a long time if you only inject 0.2 or 0.3 of it.
And so when you ship it and it's not is it reconstituted when you ship it, or it is reconstituted? Yeah. So it still has to be kept cold.
It has to be kept on, refrigerated on ice. Yeah.
Well, I would say that the compounding pharmacy that you used when you had it sent to me did a great job. Like, it came in this little styrofoam box with 2 little ice packs, and it was like wow.
Wow, yeah, that's amazing.
That is very amazing. It's you hear so many horror stories. So whoever, your partners are doing a great job on delivering your protocols, because you hear so many stories about places that ship stuff. It's not stored properly. It's not kept cold. And, NAD, I'm guessing it would just lose potency, right? If it was left out for too long. So
definitely. Yeah, it wouldn't. I haven't seen issues with that in terms of like negative reactions, but yeah, it has to be kept cold to be viable, which is, we wanted to have the therapeutic effect that we're injecting.
That's what it's all about. Okay. So in conclusion, we've concluded that NMN and NR are probably okay, but it's really, the jury's still really out on how effective they are at being converted and at getting to where they need to get to so that they can be converted into NAD in the body, not to mention whether you have all the cofactors and everything else in place to produce the NAD. If the issue is in there, then without identifying those deficits, you could be just wasting money. Whereas taking the NAD, if you're taking it in good quality NAD delivered in the right fashion, it's going to get to where it needs to get and help you out.
Definitely. Yeah. And the other thing that kind of complicates that is how good is your gut absorption?
Absolutely.
Right. We don't know that. I have reason to assume that most people's gut absorption isn't 100% of anything that they take by mouth. So
yeah, I'm with you.
I'm going more towards patches and injections just because I know I want my patients to feel better fast. Mm-hmm. And I know these mitochondrial peptides and therapies and NAD will help many of them to feel better fast. And so we want to make sure that they're getting it and they're absorbing it and it's effective and it's at the therapeutic, level to support them. So some people they have phenomenal gut health and they're a great converter. They're going to be great on NR and NMN. But for a lot of the chronically ill patients, generally there's a gut issue underlying some of those chronic infections.
Well, and I mean, even in my work with clients, you don't need to be chronically ill to have gut issues. I mean, most of us have some degree of gut permeability going on. So, to the point where I'm thinking that most people once or twice a year should be doing some kind of a gut healing protocol, just because we're exposed to so many negatives in our environment through our food, through stress, through chemicals. Is 5G an issue or non-native EMFs, lack of getting outside, like all of these different things eventually can take their toll. And I know this expression, you can only assimilate what you absorb, right? And you can only absorb what you break down. And so there's all these different points along the chain of digestion, which is even assuming that you're eating the right foods. But let's say you're assuming and that's probably the worst, right? That's probably the most vexing thing of all is people are spending all this money, they're putting all this effort into eating the right diet. And if their digestion's off or their gut permeability is off, then, they end up wasting a lot of energy. So.
Yeah, yes, absolutely. Gut is pillar number one. And you think about how important that HCl production is to actually digest your proteins into peptides, into amino acids, how many people maybe don't absorb those amino acids appropriately. And so, why peptides are therapeutic is we're giving people amino acids, those chains of amino acids to signal pathways that we want in the body. And if there's a compromised digestion, they might not be getting all of those healthy amino acids from the proteins in their foods.
Yeah.
Too.
Like your bodybuilder.
Yes, exactly. Yeah.
All right. Well, I think we've kind of covered what we wanted to cover for today. Amber, what do you think?
Yeah, I think we covered a lot.
Okay. And Thank you so much. Why don't you tell people how they can find you and reach you if they'd like to connect with you to either access some compounds or have an assessment or some kind of looking into working with you?
Absolutely. So they can find me at a couple of places. A lot of people connect with me on Instagram, which is my Instagram handle is Dr. DOCTOR Amber ND. So they can find me there. They can also find me at my website, which is drambernd.com. And then I do have it's called the Peptide Playbook. So it's essentially a PDF, an ebook that talks a lot about the peptides. It breaks down different peptide therapies as a primer and an intro to some of the other peptides that we may not have covered or that we covered in another episode. So they can definitely go look that up at peptideplaybook.com. So yeah, find me there and reach out. I'm happy to connect with anybody.
Amazing. I've got just a few things going on there, Amber.
I know.
Okay. Well, thank you so much for making time today. I know that you're visiting family right now, so enjoy your time in the cold. It'll make you enjoy the sunshine and the warmth of home all the more when you get back.
Absolutely. I will appreciate it so much more when I get back.
All right. Well, thanks again. Have a great weekend. Take care. Bye. Thank you so much for being here and listening to the Biohacking Superhuman Performance Show. My name is Natalie Nidham. You can find me on Facebook in the Biohacking Superhuman Performance group pretty much every day. Or you can find me at natnidham.com, which is my website, where you can read some testimonials from people who've worked with me. And if you're interested in a consultation or a free call, or maybe even just finding out more about biohacking, there are links to other podcasts there. There's my blog. There's a contact form to reach out to me. So thanks again for being here. And don't forget to leave us a 5-star review if you enjoy the show. And make sure to share it with your friends if you know people who might enjoy the show as well. See you next time.